Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest in studio is Jennifer Steiner. She's the CEO of Interchange. It's a family and residential and outpatient mental health treatment program for adolescents, young adults, and their families. And she's with us today to talk about CORE methodology, or CORE methodology. Welcome to the program, Jennifer.
Hi, Neal. Thank you for having me.
Now, you're the CEO of Interchange. Talk about Interchange. What exactly is Interchange, and how long has it been in existence?
Interchange is, we're a mental health care company. We've been in existence for actually almost 20 years in some form or fashion. And we provide primarily residential treatment services for adolescents and young adults who are experiencing fairly severe mental health issues. And we also have now a community-based offering where we provide wraparound support for families who have adolescents and young adults that are, struggling to thrive in their home environment and where outpatient therapy just isn't enough.
Now, when you say wraparound, are you talking about counseling for the patient and the family as well as that type of support, or is there more involved?
Oh, exactly. So we have teams that provide both a youth mentor as well as a parent coach. And that team of folks is responsible for supporting both the parents and the child, as well as facilitating really a strong connectedness for that family within the community. So helping them to tap into other resources that will help them in their healing journey.
What would you say sets you apart from some of the other facilities or programs that I'm sure you're aware of?
Yeah, so this is my favorite topic, and you touched on it in your introduction. So Interchange is doing some things that are truly unprecedented in mental health in general, even just beyond the work with adolescents and young adults. And it is within our core methodology that you referenced, which CORE stands for 4 different concepts. So if I can take just a moment, I'll give you a little overview of each.
Absolutely. Yes, please.
Great. So the C in CORE stands for connectedness, and what we really mean by that is a family systems approach. We don't fix broken kids. Kids have trouble because they have a family system that needs to get better, that needs to learn how to function in a healthier way. So we approach the problems that a kid may be presenting with by addressing the entire system and giving therapy and coaching and training to an entire family system on how to improve the way they function together. The O in CORE is the next concept, and that stands for outcomes. This is very, very important. For over a decade, we have been measuring the effectiveness of the treatment that we provide. We can tell you if someone is improved in their diagnosis and other surrounding issues when they go through our treatment. We can tell you that they stay out of treatment for years afterwards, and even on top of that, what we can do is we can watch the patient and the family throughout the course of treatment and make course corrections in the way that we're treating this family based on the data. So we are doing things with data that truly are unprecedented in mental health. The R is the third concept. That stands for relational. What that means is we are not a medical model approach. We don't have kids sitting, laying on a couch with a therapist sort of talking them through their issues. We have real relationships with our kids. We do real experiences with them because we find that actually the relationships that they develop through treatment are really the motivator for them to get well. And so we are doing it through and via relationships versus walking someone through therapy in a medical sort of separated sort of way. And then the last piece is experiential, experiential. And again, I just touched on that, but what it means is we get kids out doing stuff in order for them to get well. It's much more realistic to work through the challenges a child might face as they're, hanging off of the side of a big rock face and feeling terror than again, sitting on a couch in a therapist's office. So.
When you talk about severe mental health issues, are we talking anything from severe depression in an adolescent or young adult, or are we talking about things that are, much more in my mind, the layman's mind, as being severe schizophrenic tendencies, antisocial things, and that's, I guess, when it comes to the severity that a child presents, where do your services end and someone else takes over?
Great question, and thank you for clarifying that. So I like to define the kinds of treatment that we provide as recoverable mental health issues. Mm-hmm. We are not a provider for what I would deem as permanent and acute psychoses like schizophrenia and some of the things that you've listed. But when I say severe, what I mean is that there are many of the kids that come into treatment within our facilities that have been hospitalized for suicide, where their families are feeling very worried about their safety. And often it's not uncommon that when we have a child admit into treatment, mom and dad have not been able to leave the house for months because they feel like their child isn't safe. So severity is in their safety, and the conditions are what I would deem more recoverable, meaning depression, anxiety, kids that have gone through some kind of trauma, children that are self-harming, bipolar disorder, borderline personality, those sorts of things.
In the course of treatment, if certain things are revealed in the course of that treatment that may raise a red flag as far as some wrongdoing or criminal activity, do you have support in that arena as well? And do you guide these families through that process, or do you leave them to deal with it legally on their own?
That's a great question. So I think what we do well is we know what we're capable of treating and when things have gone outside the scope. So if we begin to see, that there has been or that there is some kind of psychoses emerging that is going to need much more rigorous medical intervention, we will help a family to transition into the appropriate level of care. And so that would be the case in any instance where, we were beyond our capability set.
Does your care and treatment ever involve any pharmaceuticals?
Well, we do have a psychiatry as part of our offering, and so we have a collaboration between the psychiatrist, our therapists and clinicians on staff, as well as the family, and oftentimes the home psychiatrist, the psychiatrist that may have been treating the child for years previous. So it's a collaboration that we have that we then will make decisions around the appropriate medication for kids. But many of our kids are augmenting the systemic treatment with appropriate medications for their conditions.
When it comes to the sharing of information about your patients and your clients and their families, is there anything in place where the family or the patient can consent to have their results shared with another facility or other doctors, just in case they find themselves in another part of the country or the world, or just for research purposes in order to make your services even better?
Absolutely. We are, as I touched on in the beginning of my interview, we are passionate about the power of data and information in the treatment of kids and families and in the continuum of care. So we have actually been a leader in nudging providers, both that are higher acuity than we are in lower acuity, to be willing to share the data, because us owning data and holding it to ourselves doesn't do a tremendous amount of good for the future of that child. So we work very closely to transfer the data to the next care provider and to actually be available as a reference for treatment if things aren't going well, or if there needs to be additional conversations about the course of treatment.
Right. Well, I'm hoping you'll come in and talk with us in other segments a little bit more about your organization and your core methodology, as well as other things that Interchange is involved in.
Thank you, Neal. It's been a pleasure.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Jennifer Steiner, CEO of Interchange, which is a family of residential and outpatient mental health treatment programs for adolescents, young adults, and their families. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.